My name is Dr. Afenya, and today we're going to be talking about hypernatremia. And if you remember, if you watch my video, you want to refer to the initial one I did before this one about hypernatremia. So now we're going to talk about high sodium level. And I work with LEX Kidney Care. So what is actually hypernatremia? Hypernatremia typically is just defined as sodium concentration that is greater than 145. So like we said with hyponatremia, we said if it is less than 135, right? So again, here we said the sodium level is greater than 145. So what are the causes? What are some of the things that can trigger this? One, it might be as a result of inadequate free water intake, or maybe excessive free water loss, or excessive sodium intake or retention, or it can also be related to just shifts of fluid, which is transient intracellular fluid uptake. All those can causes as well. Now, if you have a patient with hypernatremia, how do they present? Most of the patients will have some form of lethargy. They have weakness, irritability. Seizures is one of the things you can see as well. Then intracerebral or subarachnoid hemorrhage can also occur, and this can lead to rupture of cerebral veins with marked decrease in brain volume that can lead to coma and also death. Now, what are the differential diagnosis? Now, the differential diagnosis, you can have water loss or water deficit. This could be as a result of inadequate intake or poor water access. So if you lost somewhere in the desert and you don't have enough water, you can develop hypernatremia easily. Now, it can also due to excessive loss through either respiration or skin, increase what we refer to as insensible water loss. And then we have situations where you have heat insensitivity, and that is because the sensing area in your hypothalamus is not working, and in that case you have heat insensitivity, and then you can have tiredness and then diarrhea as well. Now, the other cause that is really important is where you can have the effect in your kidney, and that we refer to as the nephrogenic causes. It could be a hereditary nephrogenic diabetes insipidus, where there is a mutation of the aquaporin 2 as well as antidiuretic hormone receptor defects. Then the other nephrogenic causes are actually secondary causes, because you have a situation that is actually triggering the diabetes insipidus. And this secondary nephrogenic causes situations like high calcium level, low potassium level, sometimes in pregnancy, people who are on foscarnet, and then people who are on democlocycline, and then methoxyfluorine and other things as well. Now, with the other differential diagnosis, we talked about the renal causes, right, which is the nephrogenic causes. Then we come to extra-renal causes. In this case, you can have skin involvement, where you have excessive sweating, or maybe you're vomiting, or maybe you have a nasogastric or NG tube in place where there's suction, or people who have viral gastroenteritis or osmotic diarrhea leading to vomitings and things like that. Then what are the other renal causes? In this case, you're actually using renal loss, but due to different substances. For instance, loop diuretic can have you losing a lot of fluid. Then osmotic diuretics, like for instance, if you have hyperglycemia, monitor use high protein diet, or post-obstructive diuresis, or in post-acute ATM diuresis as well.